In today's world, people often have trouble sleeping. The situation has especially worsened over the past 3 years. But I think it's clear to everyone why. And often people go to doctors with sleep problems and doctors prescribe sleeping pills. In this video, you'll learn that sleeping pills can not only be helpful, but sometimes very harmful. Watch this video until the end, and you'll find out in which cases sleeping pills really can and should be prescribed. Of course, on your doctor's advice. And in this situation, sleeping pills will help improve your sleep and won't harm you. Unfortunately, the situation is such that the pharmaceutical business here actively advertises sleeping medications. And in fact, there are statistics showing that it's the third most profitable industry after arms and drug trafficking. And it's clear that pharmaceutical companies are interested in people taking a lot of medications, ideally for their entire lives. And in this sense, sleeping medications are practically ideal for this purpose, because insomnia usually lasts a long time. Sleeping medications, yes, to some extent they relieve the symptoms, but they often don't cure the insomnia itself, especially if it's chronic insomnia. Moreover, at some point, they can cause psychological and physical dependence. And stopping sleeping medications leads to a situation where a person's sleep becomes even worse than it was before they went to the doctor for sleeping pills, or before they started taking them. Secondly, unfortunately, doctors themselves do not always understand how to properly treat insomnia. Unfortunately, sleep medicine is still not taught in medical universities, and people graduate from university with almost zero knowledge in this area. But he knows that insomnia is real and that pharmaceutical companies actively advertise sleeping pills. So he thinks that if he prescribes sleeping pills, he will help the person without having the full depth of knowledge and without understanding what consequences this might have.
Question, you said that a doctor prescribes sleeping pills. For me, that's like a marker. If I go to a doctor and he tells me sleeping pills, I'm like, wait, so does that mean the doctor is incompetent? Am I understanding this correctly?
I can't say he's incompetent. Perhaps in other areas he's quite competent, depending on his education. However, doctors typically aren't taught how to treat insomnia. And so with some fragmented knowledge from university, a person comes into practice and realizes, but there's insomnia, it's distressing, and they don't realize that there are hundreds of reasons for this insomnia. So it's more his misfortune than his fault. If the doctor neglected to ask questions, order tests to clarify the diagnosis, or even take a look, that would be concerning. Vitamin, magnesium, thyroid hormones, things that could potentially cause insomnia. And what if, for example, you snore? If you have breathing pauses during sleep and, for example, you weren't prescribed a polysomnography or respiratory monitoring to determine the severity of your sleep-disordered breathing, then yes, that's an incorrect diagnostic approach. Still, in medicine, it's like first ask questions, then examine, and only then make an accurate diagnosis. So, if you come to a cardiologist with some illness, he will ask you questions, order an electrocardiogram test, Holter monitoring, and so on, then make a final diagnosis and prescribe treatment. But here, you talk for 2 minutes and are told you have a sleep disorder due to claustrophobia. But where are the questions? Medical history, examination, and diagnosis. This is purely symptomatic treatment. Once again, in cases of acute insomnia, obviously caused by stress, yes, prescribing sleeping pills may be appropriate. But if insomnia lasts for more than 3 months and it's no longer clear why it persists, here it is extremely important to undergo an examination, make an accurate diagnosis, and prescribe effective treatment that targets the causes of this insomnia. And third, we have a problem with confusion. We have insomnia as a symptom and we have insomnia as a disease. So the symptom of insomnia can accompany dozens and even hundreds of different diseases. Well, for example, vitamin deficiency, magnesium deficiency, iron deficiency, excess thyroid hormones, sleep apnea, restless leg syndrome, all of these are accompanied by insomnia. And if a doctor didn't get the proper knowledge at university, he doesn't realize that there is some obvious cause and just gives symptomatic treatment that improves sleep. But the cause isn't eliminated, and moreover, as I said, dependence develops. If a doctor has prescribed you sleeping pills, or if you have taken some sleeping medications without a doctor's prescription, give this video a like. Here's a sad situation. When someone comes to see me and says, "Doctor, I've had insomnia for 20 years. I've taken 20 different medications, and right now I'm taking 4 of them together: a sleeping pill, a tranquilizer, an antidepressant, and an antipsychotic. But you, as a leading expert in domestic sleep medicine, you must know the exact medication that will cure me, right? There is no such medication. But you can't explain that to someone who has been taking sleeping pills for 20 years and has become addicted to medication. And even when you tell someone, let's look for the cause, let's try different cognitive behavioral therapy techniques for insomnia, which is currently the most effective method for treating insomnia, behavioral therapy. No, doctor, maybe you're hiding something. You don't want to give me an ineffective pill? So this is practically a dead end. Overprescribing sleeping pills sometimes does more harm than good. Let me break down the possible negative effects or even harm of sleeping pills for you. First, as I mentioned, psychological dependence develops. A month of taking the pills is enough to make a person afraid to fall asleep without them. If they miss a dose, they think they won't be able to fall asleep, and then they really can't. After 3 to 5 months, physical dependence starts to develop. For the medication to remain effective, a person must continually increase the dosage. And the higher the dosage of the medication, the more side effects and complications it causes. If we take a group of elderly people, and they are especially often prescribed sleeping medications, one of the very serious and severe consequences is so-called pseudo-dementia. That means a person's mental and cognitive abilities decline, they start forgetting everything, they lose their memory, and then they are additionally treated for dementia. But this is not true dementia, it's just that the sleeping medications affect him this way and worsen his mental abilities. Next, elderly people often experience what's called restless leg syndrome or periodic limb movements during sleep. When a person goes to bed, they experience hard to describe but extremely unpleasant sensations in their legs, which force them to move them. And he can't fall asleep because he constantly has to move his legs. Even if he does fall asleep, his legs keep twitching and waking him up. A person comes in complaining about insomnia and they are told you have chronic insomnia, maybe you're just in a bad mood, things aren't going well for you, and so on. So here, take an antidepressant with a sedative effect or even an antipsychotic. And these medications have what's called a class-dependent effect. In 15 to 20% of cases, they worsen periodic limb movement syndrome and restless legs syndrome. So, a person comes in with the problem that their legs are keeping them from falling asleep, and they're prescribed a treatment that can potentially make their leg problems worse. The person comes back in a couple of weeks and says, it's gotten even worse. The doctor says the situation is escalating and they need to increase the dosage. Well, sometimes people tell these thriller-like stories about how their dosages keep getting increased and increased, but they just keep feeling worse. And they stop the treatment themselves saying, phew, thank God, I feel a bit better now. And the doctor really doesn't understand why the person stopped the treatment and why they actually felt better because of it. For elderly people, another big problem is lack of coordination and falls, and this increases the frequency of hip fractures. But if a person is operated on right away and the proper pin is inserted, then the person can start walking fairly quickly. In the past, they would put a person in traction, which is still sometimes done today, requiring the individual to lie down for 2 months. For an elderly person, that's practically a sentence. So, once again, you need to be extremely careful when prescribing sleeping pills, and keep in mind that with chronic insomnia, there is some underlying cause at work. And if we haven't identified this cause and just prescribed a sleeping pill, which yes, provides sleep for a while but doesn't eliminate the cause, then on one hand, we create psychological and physical dependence, and on the other hand, we don't address the cause, and later won't be able to stop the medication at all. Stopping them will lead to withdrawal symptoms and worsened insomnia, while the original cause of insomnia persists. So, it's a kind of negative synergistic effect, and the person constantly starts changing, increasing, or adding medications, and continues taking them for many years, or even decades. And in this sense, here's some advice. If you go to a doctor and your insomnia has lasted more than 3 months, meaning it's chronic, and he just listened to your complaints for 3 minutes and prescribed you a sleeping pill, an antidepressant, or an antipsychotic, well, be very critical. Try to take this seriously and go to a doctor who will actually ask you questions, order some specific tests, conduct an examination, and make a diagnosis. Usually these are either sleep specialists who focus on sleep disorders or neurologists and psychiatrists who also have additional training in sleep medicine. In 2017, all our standards for treating chronic insomnia completely changed. If before, pharmacotherapy was the first line of treatment, now the so-called cognitive behavioral therapy for insomnia comes first. This is a special program that, oddly enough, uses techniques like sleep restriction, limiting time spent in bed, relaxation techniques, behavioral methods, physical activity, and so on, and so on. And they are significantly more effective than sleeping pills. Moreover, if we identify a specific cause, like for example iron deficiency, we give the person iron and that's it, the insomnia will go away. If we treat hyperthyroidism and overactive thyroid, the insomnia will go away. That means you need to identify the cause and address the cause. But now, I promised you that at the end of the video I would talk about when it actually makes sense to use sleeping pills. I was mainly talking about chronic insomnia, which lasts more than 3 months. But if insomnia lasts for a few days or weeks, and it's really triggered by obvious stress, meaning we have a clear reason that caused the insomnia, and listen, in our lives there are plenty of these stresses. So there's an obvious reason, and there's insomnia. And in this situation, yes, it's quite acceptable to prescribe sleeping pills, of course, after consulting with a doctor and by a doctor's prescription. Why is this important and reasonable? Because if stress has caused insomnia, the insomnia itself further increases the excitability of the nervous system and the person becomes even more susceptible to stress. By the way, this can later lead to chronic insomnia. And if, in response to a stressful situation, insomnia develops and we prescribe sleeping pills, eliminate the insomnia and restore sleep, we will increase the stability of the nervous system and the person will cope with the stress more easily. But always, if a doctor prescribes you medication, after a month you need to check whether it was possible to stop taking the medication, whether the insomnia has passed, because it could have been the onset of chronic insomnia and some cause may still be present. If a month of taking the medication did not lead to a cure for insomnia, that's when you need to start a diagnostic search again, which will give a precise answer to the question, what is the underlying cause? And then address the cause of the insomnia itself. If your insomnia lasts for more than 3 months. If you have, so to speak, already visited doctors, they prescribed you various medications and none of them have really helped you, it's pointless to keep going from doctor to doctor, continuing to try different medications or switching between them. It's important to undergo a thorough examination, get an accurate diagnosis and accordingly address the cause of this insomnia. And I've been treating chronic insomnia for more than 25 years. We conduct thorough examinations, questionnaires, tests, and polysomnography. This is a special method of studying nighttime sleep, where we observe the structure of sleep, breathing, blood oxygen saturation, and many other parameters that allow us to assess sleep. Accordingly, we make an accurate diagnosis and prescribe effective treatment. In particular, I also conduct a program of cognitive behavioral therapy for chronic non-organic insomnia. In reality, it's not just causes, but conditioned negative reflexes, fear of insomnia, bed insomnia association, negative thinking, and maladaptive behavior. And now I cure 70% of patients with chronic insomnia in 6 weeks without sleeping pills. Feel free to reach out for a consultation. I consult in Moscow and online. In the description of this video, you can find links to my contact information. If you have sleep problems and you are somehow dealing with them, please describe it in the comments. Well, write who tries to use some methods without sleeping pills and how much it can help, and who, on the contrary, uses sleeping pills and believes in them. Well, we can also discuss this in the comments. In general, this is quite an interesting topic for discussion. Maybe I can give you some useful advice on how to deal with insomnia.